I'll be discussing Medicare Made Clear, so stay tuned. I'm Keith Armbrecht, founder of MedSup Savings. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So please, after this video, take just a few minutes to explore our Resource Center. You'll likely find everything that you need for Medicare. You can also get an immediate quote for your Medicare supplement insurance. Just fill out your basic information and it will provide the rates for the plans that are available in your area. It would also be a really good idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help. Okay, thanks for joining me for this video. This video is the complete overview of Medicare. So I'm going to go over literally every single piece of Medicare, and it's certainly a longer video, so grab some popcorn, make yourself comfortable, but it's going to be broken down as well. So if you're looking for certain information in Medicare, you can still come here, and if you go down in the description, and this is on YouTube, so if you're on my site watching the video, click the little YouTube button on the bottom of the video and it'll bring you into YouTube, and then you can go in the description below the video and you'll see here I have it broken down into sections. So all you have to do is click on that little time, whichever time number it is, and it'll bring you right to that section of the video. So it makes it easy if you need information on Part B or C or D or whatever it may be. Gives you the ability to get there quickly so you don't have to sit through the entire presentation. And this is going to be an entire presentation. So again, make yourself comfortable and bear with me a little bit because it's not going to be a perfect presentation. I'm going to go through this Show Me guide. And this Show Me guide is actually provided by United Healthcare. And certainly thank you to United Healthcare. It's a very good guide. And if you'd like a copy of it, you can go right into my Resource Center on medsupsavings.com and you can download it on your computer. You can follow along while we're in the video, or you can use it later, whatever you'd like to do. So I'm going to just go through it page by page, and it is 64 pages. So we're going to cover everything you need to know about Medicare, and I'm going to ad-lib a little bit in the middle. I'm going to talk about what I think. I'll tell you, how I think it might affect you and things of that nature. So understand that I'm kind of doing this from my perspective, and I've been doing this for a while. So hopefully it's going to make things a little bit clearer to you. So either you're coming into Medicare, you're turning 65, and you have to do something because at 65, if you're coming off your regular health insurance, you need to figure out your Medicare. Maybe you're already in Medicare and you're not sure you're in the right place. Maybe you're still on your employer group plan and now you're 67, 68 and you're going to be coming off your employer group plan and you need to get into Medicare. So we're going to cover really all those bases and show you exactly how it's going to function. So let me give you a little table of contents first on what we're going to be covering, and you can see pretty much every piece of Medicare. So I'm going to get into it and we'll show you exactly the things that you need to know. So here we have 10 tips about Medicare. What are the big ideas? So number one, there's two different ways to get Medicare. So that's the first thing to understand is your choice of path. So there's Road A and there's Road B. And you can either stay in regular Medicare and likely get a supplement to cover what regular Medicare does not, or you can get into a Medicare Advantage plan. So it's very important to understand the differences between those two choices because you really need to get it right the first time. You may not be able to change in the future, so you really need to get it right the first time. Number two, with original Medicare, you'll pay a share of the cost. So Medicare And when we're talking original Medicare, it's A and it's B. So A covers the building, the hospital, the physical location of where you're having your medical care. B covers the doctors, the people, the ones that provide the services. So easy way to kind of understand that: A covers the building, B covers the people. Number 3, Medicare supplement insurance helps control your out-of-pocket costs. So if you choose the road to stay on original Medicare, A and B, then you would likely pick up a supplement that covers what A and B does not. Number 4, prescription drug coverage helps limit drug costs. So again, if you're on original Medicare A and B and you got a supplement, the drug plan is a completely separate piece. So you have Medicare, a supplement, and a drug plan. And I'll go into that a little more specifically as we get into it. Know the choices in your states. Some states have different scenarios. There's really only a couple that kind of differ from the rest. But you certainly want to make sure you understand your state and how it functions. But the majority of states are all pretty much the same. And then enroll at the right time. So you need to know when to enroll, and this is really not complicated, although I talk to people all the time that, oops, they missed it, or oops, they're right at the last minute, and it's so much better to do it sooner than later. It gives you the ability to do it ahead of time, and that way you don't have to worry about getting it in time or putting it in place or anything like that. And number 7, review your choices once a year. It's a pretty good idea to take a look at what things may have changed or not changed each year. But my goal is really to put you in the right place right now, and hopefully it's going to be with you for the long term. So we want to make sure we get in the right place right at the beginning. There are some special election periods that are outside of normal enrollment, and we'll go over those. Review your current coverage. You want to make sure you understand what you have. And I can tell you that's my main goal is regardless of your choice, is to make sure you're educated and you understand what you have so that there are no surprises down the road. And number 10, help is available. So you can get help certainly from me. That's what I do day in and day out. I'm happy to help. I'm happy to answer questions. And I'll do what I can to make sure that you understand everything that you need to understand. So let's talk about what Medicare does not cover. So Medicare does not cover everything. It covers basically medically necessary procedures. So what does it not cover? It does not cover most dental care. Now that wouldn't include if you were in an accident and it was surgical type dental care. Routine eye care does not cover hearing tests. Most care while traveling outside of the United States, and that's where a Medicare supplement plan would come in because it does provide some coverage when you're traveling out of state. Medicare does not cover custodial care, long-term care, cosmetic surgery, chiropractic services, routine foot care, and acupuncture. All pretty much the same kind of stuff your normal health insurance doesn't cover, so it falls right in line with exactly the type of plan that you probably have right now. So getting ready for Medicare. When am I eligible? Well, you're eligible when you are 65 years old or you are under 65 and qualify on the basis of disability or other special situation. And I can tell you, it's a completely different scenario when you're turning 65 versus Medicare disability. So Medicare disability is quite complicated in some cases. It's certainly complicated to get supplement coverage. But turning 65 really is not complicated, and it's much easier than it seems. We just need to understand it. So I'm happy to help with any of that. You are a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years. You must be 65. Your spouse's age does not count. So married couples, when one turns 65, they are Medicare eligible, but the other spouse is not Medicare eligible. And that can sometimes create a complicated scenario if the spouse turning 65 is the one that has the current health insurance from their employer, and they're Medicare eligible, but their spouse is not. So if they drop their employer-sponsored health insurance, it leaves their spouse in a situation where they need to find insurance, so that can be complicated. So how do I get started? You must initiate the enrollment process with Social Security. So you can either go online at Social Security, and the website is socialsecurity.gov/retirement, or you can call Social Security, and I'll put the number up on the screen so that you have it for when you need it. And what you're going to need to do with Social Security when it's time for you to start is initiate your Part B coverage. Part A for the building, the hospitals, is automatic. Part A is going to start no matter what. Part B is optional, and there's a premium to Part B, and you need to actually initiate it to have it start when you want it to start. So what happens to the health coverage I have now? Pretty simple. You'll be replacing that with your Medicare coverage. So you want to set up your timelines where that ends when Medicare begins. You are going to have two choices. So it's really important to understand these two choices. This is the biggest part of your decision. You will always have Medicare A and Medicare B. So A and B on Medicare. And remember, B is optional. There's a premium to it, so understand that. And I'll get into that a little bit closer. But you can see option 1 is having Medicare A and B, and then you would likely purchase a supplement for what A and B do not cover. That way you have full coverage. And then if you need a drug plan, if you currently take prescription drugs, and I'll get into that a little bit more specific, you would likely purchase a drug plan. So option 1 is Medicare, a supplement, and a drug plan. And really not complicated, and I can certainly help make it very easy for you, and also not terribly expensive. So you need to understand the costs that are involved. Number 2 is Medicare Part C, which is Medicare Advantage. And what happens when you choose Medicare Advantage, you kind of go with an insurance carrier, whether it's United Healthcare or Aetna or whoever, Humana may be in your area. And they basically take you off of Medicare, and then you are part of their network of doctors and hospitals and things of that nature. So the difference between the two is if you have original Medicare and a supplement, you can go to any doctor, any hospital. As long as they accept Medicare, you have no restrictions whatsoever. If it's covered by Medicare, it's covered by the supplement. So it's much more flexible than it is on a Medicare Advantage plan. A Medicare Advantage plan puts you into a plan where you have a network of hospitals, a network of doctors. Depending upon the plan you choose, sometimes you can be in a plan where you have to get a referral from a primary to go to a specialist. Depends on which type of plan you choose. And what you'll find on a lot of Medicare Advantage plans is the premiums are lower. And sometimes there's no premium. So they can look very good on the outside, but just make sure you understand exactly how they function, because it's certainly a difference in the way you receive your care. So how does cost sharing work? And really, cost sharing is pretty simple. You have a premium for whatever you're doing. So your premium for your supplement plan or your Advantage plan, and then if you have a deductible on it, or if you have a co-payment on it, or if you have co-insurance on it. Those are your side of the cost sharing. So you need to understand, number 1, how much your premium is, and then if you have a deductible, how much is the deductible, because that's going to come out of pocket. How much is the co-payment? If you have a co-payment when you go to the doctor, $10, $20, whatever it may be. Or if you have co-insurance, sometimes they require you to pay, 20% of whatever the charge may be. So understand what your out-of-pocket expenses are. So here's a look at what we're going to be discussing. And again, this is quite in-depth. We're going to go through every piece of it, and hopefully you have a pretty good understanding when we're done, so that way you can get there and you can make your decision and be comfortable in making your decision. So we're going to talk about Medicare Part A, Medicare Part B, Medicare Part C, Medicare Part D, certainly a lot of pieces to it, Medicare Supplement Insurance. So we will figure it all out and make sure we understand it. So overview of Medicare Part A. And again, I like to keep things simple as we can. Pretty much Part A covers the building, the hospital, the services that are happening inside that building. So you can see a semi-private room, hospital meals, skilled nursing services, care on special units, drugs, medical supplies, medical equipment as an inpatient. So that's important to understand that drugs, if they're administered in the hospital or in the doctor's office, they're generally covered under Part A or Part B, as opposed to if you take them at home, that's where you would need a drug plan to cover those. Lab tests, operating rooms, some blood, rehab, skilled health, care to manage symptoms. So again, things that happen inside the building. Now, costs, you have the same thing. Premium, what's your premium? There is no premium for Part A. Part A is automatic, there's no premium for it. Cost sharing, there is a deductible on Part A. So your Part A deductible, if you're admitted into the hospital, and these numbers are for 2016, I'll bring up the 2017 numbers. Part A deductible in 2016 is $1,288. In 2017, it's $1,316. So that's going to be your cost. If you're admitted into the hospital, you're going to have an immediate cost out of pocket of $1,316 in 2017. Copay. Your copay after you have stayed a certain number of days for hospital stays, you will pay for the first 60 days, there is no copay. 61 to 90 days, it's $329 a day, big copay. And if you're there longer than that, 91 to 150 days, it's going to be $658 a day. Big copay. So obviously, that's a significant hospital admission. Very rare for anybody to face that kind of hospital admission. But if you are there, you need to understand what your out-of-pocket costs would be. And again, that's where a Medicare supplement would come in. Medicare supplement would cover those costs for you without you having to come out of pocket. Now, we're going to talk about coinsurance. There is no coinsurance for Part A, so nothing to really worry about there. When can I join Part A? Part A starts as soon as you become eligible for Medicare. So how do you sign up? If you're receiving Social Security benefits, you should be automatically enrolled in A and B, but check with your local Social Security office. Now, what I found in my experience, if you are receiving Social Security, you would likely get a postcard from Social Security saying, we're going to start Part A and Part B unless you tell us not to. And again, A is going to start no matter what. B is the one that is optional. If that is not the case, you need to contact Social Security to initiate your Part B coverage. So, and again, it can't refuse to cover you. There is no renewal. You don't have to worry about it. It comes automatically. And what are your share of Part A costs? We kind of just did this kind of briefly. So what are your share of Part A costs? And just something to understand here on kind of how it functions with that deductible. If you go into the hospital, you're going to have that deductible immediately. And again, in 2017, it's $1,316 of a deductible. So here you have Julie. She went in the hospital for 3 days. It cost her $1,316. That's her deductible. So she did not have a Medicare supplement. If she had had a Medicare supplement, it would have paid that $1,316. Would not have cost Julie a nickel to be in the hospital. So that's always a very good thing. And then we have what is called a single benefit period. So we have Hector, who went in the hospital for 5 days, and then he was readmitted and stayed for another 3 days, and he wasn't out of the hospital for more than 60 days. So if you are admitted in the hospital and then you're released and then you're readmitted in the hospital within a 60-day window, you don't pay that deductible twice. You only pay it once with that 60-day window. If it had been 65 days or 75 days, then that deductible would have come up again and you would have paid that $1,360 twice. So you have a 60-day window where that deductible kind of is taken care of there. So here is the scenario where you have the double deductible. So in the hospital for 5 days in January, readmitted in September, stayed for 65 days. That's not a good thing for Margaret. So Margaret had a pretty bad hospital admission, and we forgot to unplug the phone. Let's do that now. Okay, so Margaret is now in the hospital for 65 days. So first she had that deductible of $1,316 in 2017. Then she came back in September, 1316 again, and then now days 1 to 60, no copay. Days 61 to 65 it's a little bit more than that now, but 1610. We'll go with the numbers that are on the page here. So Margaret had an out-of-pocket expense for that hospital stay for the year of $4,186. And obviously we know it's a little bit more than that. It's probably about $4,500 total. So understand, if Margaret had a Medicare supplement, it would have covered all of that. She wouldn't have been out of pocket at all in working with that type of hospital admission. So very important to understand what type of exposure you have with just Medicare A and B. Now here we have a long, poor Juan. He's in the hospital for 185 days. So his deductible, 1316. And then days 61 to 90, 322 each. And actually they're going to go to 329 each. And then days 91 to 150 are going to 658 each. So poor Juan here, wow. And then he stays from days 51 to 180 at $1,200 a day. That's crazy. So Juan has an out-of-pocket expense of $91,000. Going to be higher than that with the 2017 numbers. So $92,000 or $93,000 out-of-pocket expense for Juan on top of a crazy medical scenario that's caused him to stay in the hospital for that long. Understand, if Juan had had a Medicare supplement plan, he'd have had a zero out-of-pocket expense in that scenario. So understand that and keep that in mind. Overview of Medicare Part B. What is covered by Part B? And again, A is the building, B is the people. Doctor's visits, ambulatory, outpatient, preventative care, clinical laboratory, x-rays, diagnostic, durable medical, emergency room services. So pretty simple. Again, just separate them kind of much more generally. A is the building, B is the people. What are the costs that are part of Part B? And number one, you have a premium for Part B. And this premium is income-based. So if you'd like a copy of the outline of the income base, then let me know and I'll be happy to email it to you. But basically, it's going to start around $104, but that's with kind of some help. Premiums for Part B are going to start, if I can find it here, I know I have it. They're going to go, they start on the income base, so it runs around $134 in 2017. So that's going to be your standard premium. It was $121. Now it's going to go to $134. So it's $134 a month for Medicare Part B. Income level, if you file individually, is going to start at $85,000. If you file jointly, it's going to start at $170,000. So that first increase, if you earned above 85 on an individual basis or 170 on a joint basis, it's going to take it from 134 to 187. And what's kind of crazy with the income scenario is the income that they look at is 2 years ago. So you may be coming into Medicare and you may be retiring and you may have made significant income 2 years ago, but you're not making significant income now. The income they're going to look at is 2 years ago. And it goes all the way to if you made above 214 on the individual level or 428 on the joint level, it's going to take your premium from $134 a month for Part B to $428 a month for Part B. So significant income-based premium on Part B. Now, I have had folks that were in that situation where they made significant income a couple years ago and they aren't doing it now. You can file an appeal, but it's a process. And it's really unfortunate that there's that much disparity based on income. So I always tell people you're a victim of your own success. And that's why you'll be paying much more than others that are on the plan as well. So when you look at cost sharing, deductible, so before Part B begins, there is a deductible of, in 2016, it's $166. In 2017, that's going to go to $183. So not a big deductible on Part B. Copayment, there really is not copayment for such scenarios on Part B. There is coinsurance. So Part B pretty much covers 80%, and then you're responsible for 20%. So when you have Part A and Part B, you have an out-of-pocket expense of Part A deductible of $1,316. Then you have that coinsurance in the hospital if you're there for more than 60 days, which can absolutely be significant. And on Part B, you have the deductible, $183, and then you're 80/20. So when you're going to the doctor, you're going to pay the first $183. After that, it's going to be an 80/20 scenario. If you have a Medicare supplement plan, it likely will cover that Part A deductible. It'll cover the Part A coinsurance for the more than 60 days in the hospital. It will likely cover the coinsurance on Part B, the 20%. Depending upon which plan you choose, you're likely still going to have the $183 deductible. But that's okay. $183 deductible is not a big deductible. I can't imagine what your deductible might be right now before you come into Medicare. So we can certainly live with a $183 deductible. So when can I join Part B? Part B you can join when you're turning 65, obviously. So you want to do that. You have a window of 7 months. It's 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after. You obviously want to do it before, and do it at least 60 days before the month of your 65th birthday. Now, when you sign up, if your birthday is June 22nd, you're going to be effective June 1st. So unless your birthday is on June 1st, you're going to always be on the first of the month of your 65th birthday. If your birthday is on the first of the month of your 65th birthday, you're going to be effective the first of the month before the month of your 65th birthday. So hopefully that made sense. But it's the first of the month of your 65th birthday. And do it sooner rather than later. Just makes it so much easier for you when you're doing it. Now, outside of that, if you are still working and you have employer coverage from work and it's good and it's better than what Medicare may be, your employer may be contributing 100% of your premium or 75% of your premium. If it makes sense to keep that, then you absolutely want to keep it. What you want to make sure is that they do not start Part B. So make absolutely sure that they do not start Part B. Number one, it's going to cost you a monthly premium. And number two, that is your trigger window when it's time to come into Medicare. So when you come into Medicare and you'd be looking for a Medicare supplement plan, when you're turning 65, you can choose any plan you want, and they cannot say no. And that's absolutely a good thing. So whether you have pre-existing conditions or you're unhealthy, whatever it may be, you can choose any supplement plan you want, and they cannot say no. When you elect your Part B for the first time, same situation. So if you kept your work coverage and you're now 68 and you're going to retire and you start your Part B, it's just like when you turn 65. You can pick any supplement plan you want. They cannot say no. After those two or either one of those situations and you're in Medicare, and if you wanted to change your supplement company or plan, you then have to go through medical underwriting. In other words, you have to answer all the medical questions. And if you're healthy, no problem. If you're not healthy, problem. You won't be able to change a Medicare supplement plan. So understand that coming into 65 or starting your Part B, you can pick anything you want. After that, you have to be healthy to do it. So again, we want to make sure we get you in the right place at the very beginning so we don't have to worry about that down the road. Hope that made sense. So what is my share of Part B? And again, pretty simple. Part B is deductible, $183, and then it's 80/20. Now, what's kind of scary about that is on that 80/20, there's no stop. So if you had a $10,000 expense, you'd be responsible for $2,000. If you had a $100,000 expense, you'd be responsible for $20,000. So that is where, again, a supplement would come in to provide protection against catastrophic events, and makes a lot of sense to consider while you're doing part of Medicare. So let's see. We're talking doctors who accept Medicare and doctors who don't accept assignments. So we're going to talk a little bit about excess charges. I'm not going to get too deep into this right now because I have a video on that. And if you watch, and I'll put below this the link to the best Medicare supplement plans, explains Medicare excess charges and things of that nature. But it's not that important right here to kind of worry about. So we'll talk about that in a different part. So now we're going to talk about Medicare Part C. This is Medicare Advantage. And again, something to understand. And it absolutely works great for the right situation. I am not a big fan of Medicare Advantage. I'm not sure why they call it Advantage because I don't view it as an advantage. It takes you away from Medicare and really puts you in the custody of an insurance company. And they are then your decision makers on your care. And they can deny coverage. They can make you go to different providers that you may not want to go to. But in some cases, they work very well. And, you know, from an out-of-pocket cost, they're generally very inexpensive on the outside, and then they can be more expensive on the inside. So it's very important that you understand how they function and the fact that you may not quite have as much choice as you would with a Medicare supplement plan. So again, understand two choices: Medicare with a supplement or Medicare Advantage. Those are your two choices. And they're big, big choices. So make sure you understand what you're doing. So under a Medicare Advantage plan, I'm not going to spend too much time on it, but what providers can I see? Generally, they have a network of providers that, you know, they have a network of doctors and a network of hospitals. Some have PPO plans where they give you the ability to go out of network. However, in most cases, it's pretty much cost prohibitive to go out of network. In other words, the out-of-pocket cost would be more than you'd be willing to spend to go out of network. So even though you have an out-of-network benefit, you're highly unlikely to ever use it because the cost would be significant. So you can have a deductible, a copay, a coinsurance, and a max out-of-pocket limit. So make sure you understand all that when you're looking for it. There are good pieces to Medicare Advantage. They include drug plans. So you don't have to worry about getting a separate drug plan. They can include things like dental and vision and some ancillary services and maybe, gym memberships or things like that. So they package them to encourage you to join. And how a Medicare Advantage works, and people go, well, how can it be so cheap? What's the incentive for them? When you go into a Medicare Advantage plan, the government pays that insurance carrier anywhere from $800 a month to $900 a month to $1,000 a month to take you off of Medicare. So Medicare would certainly be happy with many folks coming off of Medicare and then becoming the responsibility of an insurance company. And the insurance company obviously wants that huge premium, so they market very heavily. And you certainly see during open enrollment every year how many TV commercials there are and how much mail you get. They want you because they want that big premium that's coming from Medicare to take you off of Medicare. So just understand how it functions. It's not free. It's not anybody doing you a favor. Medicare is paying an insurance carrier to take over your medical responsibilities. And that's kind of how it functions. So you can understand kind of how that works. And again, the Medicare Advantage plans can differ greatly. So you need to understand if you're looking at one, what your out-of-pocket expenses would be. And generally, the lower the premium, the more restrictive. So if it has a zero premium, it's likely going to be a very restrictive type plan where you may even need to get a referral from a primary care physician to go to a specialist, things of that nature. So just kind of understand that. I'm not going to go through too much of it. I have another video specifically on Medicare Advantage plans, so if you'd like to take a look at that, you're welcome to. And then we'll look at the next section on medical savings accounts, we're not going to talk too much about, this is like HSAs where you can put money in and it's there for you to use for your health needs as you go forward. Overview of Medicare Part D. So this can be fun. And, Part D is the Medicare drug plans. And you've likely heard some stories about Medicare drug plans, things like Doughnut Hole and catastrophic coverage and things of that nature. And I can tell you, it is complicated. It is convoluted. It is crazy. It is unfortunate. And that's how they have set it up. So if you take significant amounts of prescription drugs, you really need to understand how Medicare Part D functions. And the best way I can tell you is with my video on Medicare Part D. So you need to take a few minutes and watch the video on Medicare Part D because it's its whole animal. And I couldn't explain it within this one very quickly or very easily, but absolutely something you need to understand. It's something you can manage. So you certainly need to understand it, and it has different pieces. Like here it has initial coverage, and then it has a coverage gap, which is known as the Doughnut Hole. You've probably heard of the Doughnut Hole. And then if you survive through the Doughnut Hole, it then goes into catastrophic coverage. So again, take a few minutes. I'll put the link to the video below this one as well. So below this, you'll have Best Medicare Supplement Plan. You'll have Medicare Part D, and then there's the Part D penalty, which you need to understand. So when you come into Medicare, if you don't purchase a drug plan right when you come in, and then you need it down the road, there's a penalty because you didn't buy it when you first came in. I also have a video on that penalty, and I don't always recommend you buy it. If you don't need it, I don't think you should buy it, even though there's a penalty, because the premium that you'll save between now and when and if you ever need it far outweighs that penalty. So, but again, something you need to understand. So I want to show how it functions, and then whatever decision you make is the right decision, as long as we understand it. So take a look at the video on Medicare Part D, and that'll help you out in that situation. Overview of Medicare supplements. So some people find this very complicated, and I try to make it as easy as we can, so we don't need to make this complicated. There really are only a couple of choices, even though they lay out a whole bunch of choices. So, what will it help you with? Your Part A, your Part B deductible? Basically, what Medicare doesn't cover is what the supplement is there for. So it's just a question of finding the right plan for you, and once we find the right plan, finding the right insurance company that offers that plan for you. So understand this, that Medicare supplements are standardized. So you have Plan G, you have Plan N, you have Plan F. Plan G is Plan G is Plan G. Doesn't matter if it's with Mutual of Omaha, if it's with Cigna, if it's with Aetna, if it's with United Healthcare. It doesn't matter. They all are exactly the same. So very important that we find, number one, a quality carrier, and number two, the lowest cost. So what my goal is to make you happy and to also make your doctor happy. It's very important that when you go to your doctor and you give them your Medicare card and you give them your supplement card, that they're happy, that it makes their life easy, that it's a brand carrier where they likely get most of their reimbursements from already, so they don't have to work extra just to get paid. So I want you to be happy, and I want your doctor to be happy, and that's what we'll go over if you let me help you with your Medicare supplement plan. So, and that's what I do. I do Medicare supplement plans. I help you find the right one that is right for you wherever you are. I'm licensed in, I think, 35 states, so I can help most everyone. I'm certainly appointed and licensed with just about every carrier, certainly the major carriers, and it doesn't make any difference which one we choose. And if you allow me to help you, there's no cost to you. Whichever insurance carrier we choose, they pay me a little bit to act as your service agent for now and in the future. So I'm happy to help you now. I'm also happy to help you in the future. And that's kind of what my role is for you, is to have somebody that can help you with whatever comes along in Medicare. And that's what I'm happy to do. So here we have our chart of Medicare supplement plans. And again, there's too many choices here. We don't need all these choices. And if you watch the video below, Best Medicare Supplement Plan, I'll outline exactly what I think are the right choices. And then we figured out specifically wherever you're located on what makes the most sense. So we're not going to run through each one of these because it just doesn't make sense to do so. Very specific on the video below, and I'm happy to talk specifically, with you. Now, there are some programs for people with lower incomes, so you want to certainly look into that. There's PACE, there's Medicaid, there's Medicare savings programs, so forth and so on. So if your income is around $17,000 a year, you can get help. For couples, $23,000 a year, you can get help. And here's our windows and timing. So Part A, Part B, you got that 7-month window, and it's wrapped around the month of your 65th birthday. So when to enroll in Part A and Part B. And again, A is automatic. B, you have to initiate. And it's going to start on the first of the month of your 65th birthday. So pretty simple, pretty easy. Same thing with Part C. If you decide you're going to go into a Medicare Advantage plan, you're doing that at the same time. Same thing with D and with Medicare Supplement. So whichever road we're going to take, doesn't matter. You have that same window. It's 7 months wrapped around the month of your 65th birthday, or when you're coming off your group insurance plan. So you may not come off your group insurance plan until you're 68, 69. I actually just helped a very nice lady who was coming off her group insurance plan at 84. She worked until she was 84, but she was thrilled to work. She loved what she did. So that was a wonderful thing. But her window didn't start until she came off. So at 84, she could pick anything she wanted, and they could not say no. So very important to understand that. Switching plans. Again, pretty simple without going through all this entire chart. When you come in or when you start Part B, carte blanche. Pick whatever you want. They can't say no. After that, you can change during open enrollment from Medicare Advantage to Medicare Advantage, or Part D drug plan to Part D drug plan without any questions during open enrollment. Medicare Supplement, you have to go through medical underwriting once you're in Medicare. So if you're on an Advantage and you're unhappy and you want to get off in open enrollment, you can get off it. And you can go to A and B, original Medicare. But to get a Medicare Supplement, you have to go through medical underwriting. So they can say no, and it's pretty much major stuff. So heart, lung, respiratory, blood, kidney, cancer, Alzheimer's, scenarios like that. It's kind of like qualifying for life insurance, that in order to get a Medicare Supplement plan, once you have been in, the insurance companies can say no. So obviously, they're not going to accept folks where they know they're going to have expenses that outweigh the premium. Obviously, that's not how insurance works. So it's important to make the right decision in the beginning. So keep that in mind. Let's see what we have now. So reading the cards. Pretty simple. You'll get a Medicare card in the mail, and it has your Medicare number, which is your Social Security number. It's followed by an A or a T, and that shows when your effective date is for Part A and for Part B. So make sure you take a look at everything as it comes along, and it will help you out. Now, there's some other information in here, and again, things like hospice and things like that we're not going to go into specifically right now. But again, if you'd like to download this, just go to the Resource Center on MedSup Savings. It'll be right there for you to download. The frequently asked questions, also not something we're going to go through one by one. All the glossary items, and everything is here. It's got resource numbers, where to get answers, comparing plans. Gives you a little chart in the back. And again, it's really not that complicated. And if you give me a call, I'm happy to go through it and just make sure it's nice and easy. And what I will always do is tell you what I think. And that's what I want from someone when I'm dealing with something that I don't quite understand, is I want somebody that knows what they're talking about and will tell me what they think I should do. And I always preface that with, If you don't agree with that, that's okay too. I want you to understand what your choices are, and then from there we can make the right decision. So that gives us a pretty good overview. We got it done in about 45 minutes. I'm actually kind of surprised that we got through it in about 45 minutes, but that should give you a pretty good understanding. And again, I have videos on every piece of Medicare, so take a look in the Resource Center, and I hope you'll find your answers there. And then I'd certainly appreciate it if you'd allow me to help with your Medicare supplement. That's how I earn my living. And again, I'll be there as your service agent for now and in the future. When things come along, you always need somebody to call. So I'm happy to help. And if there's anything I can do, just let me know. I hope you have a fantastic day.